Hello, I am Dr. David Havlin. I have been here at the Havlin Hospital and the Winchton Health Center practicing as a family physician for the past 35 years. I want to talk to you, to my own patients, and to you on the medical staff, on the hospital staff, and to you in my own office, and to you in Gardner, Winchton, Baldwinville, Ashburnham, Westminster, Hubbardston, Phillipston, Royalston, Athol, Orange, Petersham, Rindge, Fitzwilliam, Troy, and Jaffrey. I have treated many of you both in the hospital and in the office, at the nursing homes, in the group homes, on the football fields, in your own homes. I have seen births, injuries, illnesses, diseases, and deaths. I have attended wakes and funerals. We have laughed together and we have cried together. But never have we faced anything like this pandemic. SARS-CoV-2, the new coronavirus, and COVID-19, the illness, are real. Our lives, our nation, and the world has been completely upended. Nearly a year and a half ago, during the first surge in spring 2020, I was laid low by the virus. In April, I got the infection while caring for residents at a local nursing home. The virus hit the facility hard and fast in late March. I developed progressive symptoms of fever, muscle aches, weakness, and shortness of breath, completely losing smell and taste. In April, I was admitted to the ICU at Havlin Hospital with acute respiratory failure from COVID pneumonia. I was in the ICU, this ICU, for 6 days, receiving the best of care from my colleagues and nurses with whom I have worked for years. I survived and was discharged home, and after a prolonged recovery, returned to work in June. It took 6 months for my breathing to fully recover. Diminished smell and taste still linger to this day. Since March 2020, treatment of the viral infection has come a long way, but people are still becoming critically ill and are dying from the infection. And many people who have recovered are developing long COVID syndrome that may last months or longer. We on the front line, the doctors, the nurses, the nursing assistants, the respiratory therapists, the phlebotomists, the radiology technicians, and all the support staff continue to give outstanding care despite the risk to ourselves. More than 3,600 healthcare workers in the United States and over 17,000 healthcare workers worldwide have died in the first year alone. Over 600,000 Americans and over 4.5 million people worldwide have died. As of this month, 1 in 500 Americans have died from this viral contagion. Today, it is heartbreaking to care for our patients because most of these hospitalizations, ICU admissions, and deaths are now preventable. You know what I mean. These deaths are preventable. It was clear from the start that the vaccines against this virus would be necessary to contain and control the pandemic. And now, after rigorous testing, we have 3 effective vaccines in the U.S. The 2-dose mRNA vaccine made by Pfizer-BioNTech and by Moderna, and the single-dose vaccine made by Johnson & Johnson. These vaccines did not come out of nowhere. They are the results of 30 years of painstaking research and development by dedicated scientists who have made amazing strides in understanding how our immune system works. The vaccines initiate a remarkable and a beautiful dance of molecules and living cells of the immune system to fight the invading virus. There is no natural born immunity against this virus. There are only 2 ways to gain immunity. First, through the infection that carries a 20% risk of hospitalization, a 5% risk of ICU admission, and a 1% risk of dying for a low-risk person, but as high as a 10 to 30% risk of dying for a high-risk patient. The only other way to gain immunity is through vaccination, which carries a less than a 0.005% risk of a serious adverse reaction, a very, very low risk. These vaccines are safe and they are effective in preventing hospitalizations and death. That is the bottom line. The vast majority of you in the hospital and medical offices, nursing home staff, and many people in our area have gotten your vaccines. I want to thank my patients who have listened to my advice and have received one of the vaccines, but many of you have not done so. I am talking to you, my unvaccinated patients. I have asked you why you have not been vaccinated. I have heard all sorts of reasons. I understand your concerns about these new vaccines, the speed at which they were developed, the FDA emergency use authorization, the safety of the vaccines, and more. But after over 385 million doses given in the United States, and after at least 170 million Americans having been fully vaccinated, I am quite comfortable in recommending the vaccines without reservations. I had my 2-dose Pfizer vaccine in January. Many of you say, I just don't want it. Well, I'm saying that after all is said and done, your vaccine is waiting for you. Get it done. Vaccination is not just for you, but also for your family, for your neighbors, for your schools, for the rest of us. Remember, the virus does not care who you are, what color of skin you have, where you live, whether you're rich or poor, how old you are, what your religious beliefs are, what political views you have. The virus survives only by replicating inside you, spreading to other humans. We had a brief window of optimism this summer, but we are now having another wave of infection, another surge in our very own communities in Gardner, Templeton, Winchendon, and all the surrounding towns, driven in large part by the Delta variant and by mass fatigue and by letting our guard down and by incomplete vaccination. As the Delta strain makes its way through our communities, we're now seeing vaccinated people get COVID-19 infections. But guess what? The vaccines are working. They are not getting seriously ill, not ending up in the hospital, not dying. At this time, virtually all the COVID admissions to the hospital, to the ER, the medical beds, and the ICU are unvaccinated people. Most of you will recover at home, but when you end up in the hospital, we will do our very best to care for you. We will be by your bedside when your loved ones cannot be there, holding your hands, helping you breathe. We will be by your bedside when you die from a preventable infection. Don't be one of those patients. Get the vaccine. Those of you who have already had the virus, get the vaccine. Your immunity will be boosted tenfold or higher. Wear your masks. Get the vaccine. Thank you.